we've heard a lot about what the National Trust Fund was set up to do earlier this year by His Excellency, the President of the Republic. We have heard, and perhaps it's important to just reiterate what it is that the fund was set up to do. So it was set up to complement the efforts of government to combat the COVID-19 pandemic by providing an avenue for well-meaning individuals, groups, and corporate bodies to contribute or donate monies and resources that may be required to combat the disease, as well as to receive any monies or resources contributed or donated to combat the disease. These amounts and other resources that are donated to the fund, the trust fund, are required to be managed by a board of trustees that have been introduced this morning. In managing the resources and the funds that are donated to the trust fund, the trustees are required to disperse these resources in a way that supports persons engaged in the combat of the pandemic, as well as support the needy and vulnerable persons infected with or affected by the disease. So this is what we've set out to do as a trust fund. Since we were sworn in April this year, we have tried to understand what the pandemic has done to Ghana, both on the health side of things, as well as on the social and vulnerable, and the social and economic impacts of the pandemic on the people of Ghana. You have heard the numbers from earlier remarks made by the chairperson of the trust, of the Board of Trustees, which indicated that we have received a total of 57 million Ghana cedis to date, and yet still have received non-cash donations in the form of services, in the form of other non-cash contributions, all totaling roughly around 8 million Ghana cedis. All of these have come from over 600 donors. In the work that we've done to fulfill our mandate of supporting persons engaged in the combat of the disease, as well as in supporting needy and vulnerable persons infected with or affected by the disease, we have disbursed a total of about 41 million Ghana cedis to a variety of beneficiaries, many of whom are represented here today. And I am aware that a few of them will be speaking in their own language after this session. So as of the end of August, we have distributed PPE worth about 10 million cedis and other medical items to over 54 treatment and health centers in all of the 16 regions of the country. So we've been nationwide in our coverage. We have given an amount of 6 million cedis to the COVID-19 private sector fund as they constructed the new Ghana East Infectious Diseases Hospital, which we heard Dr. Ali Samba say was going to be very much needed in the days ahead. We have given 2.5 million cedis worth of logistical and financial support to the NCCE to enable it to embark on a nationwide COVID-19 sensitization program and an awareness raising program on the COVID-19 disease. We have donated about 860,000 cedis to rehabilitate and equip an isolation center at the Pantang Psychiatric Hospital, and also donated a ventilator worth $30,000 to the same facility. We have disbursed an amount of 5.5 million cedis to the Ghana Health Service for the purchase of reagents to enhance testing in the fight against the pandemic. We have disbursed an amount of 1.9 million cedis to the Veterinary Services Directorate of the Ministry of Agriculture to also help them purchase reagents for testing. We've provided an additional amount of 8 million to purchase PPE and other protective logistics for various tertiary institutions in Ghana before we had the SSS 3 and the JSS 3 students go back to school in the last few months. And ladies and gentlemen, the list goes on. We have supported the research that Dr. Texan just alluded to understand the socioeconomic impact of the pandemic on the Ghanaian people so that we could make evidence-based, we could design evidence-based interventions that would make an impact. We have provided 10 saloon cars and 2 pickup vehicles to 12 testing and isolation centers across the country. And we have provided an ambulance to the Ga East Municipal Hospital, Accra, as well as an assortment of food items to children's homes, homes for the aged, and various other groups in the country. Altogether, you can sort of categorize all of our interventions in a number of ways. One, interventions that have helped to prevent the disease through our distribution of PPE and the like. Interventions that have helped with healthcare aspects of dealing with the pandemic, which have included improving the testing capacity of the testing centers. We have provided some of our support to support the treatment of patients who have been diagnosed with the disease. And then you heard about the sensitization programs that we have supported through NCCE. What we haven't done too much of and what we really want to do a lot more of now is the economic relief to persons who are needy and vulnerable as a result of being infected by or infected with or impacted by the disease. And that's really one of the key areas we'll be focusing on going forward. So having talked about how much we have raked in so far, and thanks to all of our donors, far and near, who have made strenuous efforts to contribute to the work of the Trust Fund, and also having discussed how much we have done in terms of with the resources that have been donated to the Trust Fund, we now are at a point where together as stakeholders in this fight must ask ourselves, where do we go from here? Ladies and gentlemen, we have heard the numbers that we were informed of a little while ago about the fact that the pandemic is still an issue in Ghana, all around the world, and also in Ghana. We were of the mistaken view that it was gone until it reared its head again in the last few weeks, and we've seen the numbers creep up. It's good to know that the numbers are coming down slightly again. We thank God for that. And while we all continue to pray that COVID-19 very quickly becomes a thing of the past, we have to be ready to fight it. We have to be ready to continue to fight it with all the strength that we have. And the Trust Fund was set up to complement the efforts of government. Government continues to fight this battle. Government continues to do everything possible to tackle both the health sector and the economic and social impact of the pandemic. Our job with us as Trust Fund is to mobilize resources from the rank and file of well-meaning individuals and organizations, and then to support these efforts of government. As we have heard from Dr. Texan, government's revenues have dwindled, same impact of the pandemic, affecting government revenues. At the same time, government is having to spend a whole lot more money than it would have budgeted for. And therefore, the capacity of government to continue to fight this depends on all of us and the extent to which we're able to support government going forward. And so here comes the reason why I am here, to appeal to every well-meaning Ghanaian, and not just Ghanaians, individual, society, association, corporate institution, traditional rulers, faith-based organizations, NGOs, whoever they may be, to get on board. The work is not done yet. The work is not done yet. We heard a lot from Dr. Ali Samba, the challenges in relation to logistics, including sometimes vehicles to move people around to conduct testing and tracing and all of those very important tasks. We have heard about the important needs that there are, even in terms of feeding healthcare workers. I still remember seeing a video sometime in July from a nurse in the UK who had to work a 72-hour shift non-stop because they didn't have enough healthcare workers, and a few of them who were there had been camped there for sometimes 3 days at a time. And she had come out of the hospital after 72 hours of working straight and was trying to find food to buy and couldn't find food because people were hoarding all the groceries from the stores. And this woman cried and said, "Don't do this. I'm trying to save lives. At least I need to have food to eat." And it was interesting to hear that in Ghana as well, healthcare workers need food to eat to be able to continue to make the sacrifices that they make at the front line to save people who are sick. It is also important to think of the fact that, as Chairperson said, elections are around the corner. If we don't manage, if we don't sensitize and provide enough PPE, there may be a spike, and we don't want that because somehow this disease goes around. And then think of schools reopening in January, as was previously announced. That is going to put a huge demand on government for PPE and for all sorts of other support. So there's clearly a need. We've already heard about the fact that there's a vaccine around the corner, hopefully, but there's a whole lot more that needs to be done to get that when it's ready, to get it here in volumes that would make a difference. There's a lot of ongoing research that needs to be supported. And as I mentioned before, the socioeconomic impacts of the pandemic are real. People have lost their jobs. Households have been pushed into poverty. It affected women disproportionately, especially households headed by women, because of the informal nature of many of the jobs that these women hold, or the businesses that they engage in. And so the needs are real, and we haven't even scratched the surface of this need. And while government makes every effort to do what it has committed to do for the Ghanaian people, it is our collective responsibility to come together to continue to make a difference for the sake of our dear brothers and sisters, and indeed for all of us. And so I'd like to call at this point on all well-meaning Ghanaians and everyone around the world, in the diaspora, wherever they may find themselves, to come on board, all hands on deck at this point. It is important that we all come together. Everything you donate to this trust fund is well managed by a board of trustees that takes this work very seriously, extremely seriously. And everything we do is backed by data, is backed by fact, is backed by the appropriate paperwork, and it's all there for the purposes of accountability. We have established a website that publishes the list of all our donors and the amount and the resources they have donated. We publish a list of all of the interventions that we have made and who are the beneficiaries of these. This is all transparent information. And from time to time, we will continue to update these lists on our website. And we even do publish these in the newspapers as well, I think at the end of every month. And so I would encourage all of you to sort of dig deeper into your pockets and please make it a point to support the work going forward. We have come so far with the help and generosity of Ghanaians and indeed many foreigners as well, but we're not where we want to be. There's a whole lot more ahead that we need to do so that we can beat this disease. Let me mention, it's worth mentioning that all contributions that are made to the trust fund as a matter of law are tax deductible, and the GRA, the Ghana Revenue Authority, has certified this, and so When you give to the fund, we give you a receipt that you can use in filing your taxes with the Ghana Revenue Authority so that you can get some tax waivers to the extent of the contributions you have made to the trust fund. I believe that I have covered all the bases, but if there are any questions, I will be able to answer them. How to give to the fund? I believe there will be a list of bank accounts that will be shown on the screen at the appropriate time, so you can donate cash straight to a bank account from wherever you are in the world. We have short codes on all of the mobile phone networks: MTN, Airtel, Tigo, Vodafone, and our offices are located in Kanda near the Jubilee House. We're open for business, and our telephone numbers and all of that are available on the website and are searchable by Google, and you can find us anywhere you might be and contribute one way or the other. If you do have non-cash contributions, we can arrange for storage and logistics and all of that. If it's in the form of services, we will be very happy to engage with you as well. So, ladies and gentlemen, on this note, let me remind us all, as His Excellency the President always says, the battle remains the Lord's, and this is a battle we're going to win by the grace of God and by the help of every one of us. Thank you very much.